Okay, so as you can see from the agenda, we have quite a few things to go through today, and it's a lot of important information. So if you can, please stay with us, stay active and engaged. So the first thing we're going to talk about today is the setting expectations. So this is basically what is expected of you when you're abroad. So we'll unpack these just a little bit. So one is please remember you're an ambassador of the US and of UTK, so please act accordingly. Also remember that there are consequences to violations of behavioral and academic expectations, and that you still have to maintain the UTK Student Code of Conduct even though you're abroad. So the first thing is whether you like it or not, you will be an ambassador of both UTK and the US while you're abroad. In some locations, you may be one of many students from the US that people in the host country will meet or will have met. In other locations, you may be one of a very few, or maybe even the only student from the US that they will have ever met. So just remember that whether you like it or not, you are an ambassador of the US and of University of Tennessee abroad. Also remember something to note is that while politics and religion are not necessarily like polite conversation starters in the US, around other areas in the world, it is completely okay to ask about political stance, religious leanings, all of those kinds of things. So don't be surprised if somebody asks you what you think about XYZ political policy in the US, or whether you or what kind of religion you adhere to, or if you are religious, or what does that look like, and all of that kind of stuff. We have heard from some students that students sometimes have found it useful to prepare some answers ahead of time, or at least to think about it ahead of time in case they're asked this, because again, it's not generally a very common thing in the US. So just be aware of that. Also be aware that there are consequences for violations of behavioral, and I will add academic expectations. The academic expectations aren't that different from what you would normally probably see on campus, but the behavioral expectations are a little bit different. So just be aware that, again, especially for behaviors that endangers you or someone else, we are required to report that to the appropriate authorities, whether that's UTK authorities or state authorities or whatever. We are required by law to do that. So just keep that in mind. It could be that as a result of any behavior that would not be okay on a program, that you could undergo conduct sanctions. So student code of conduct could be involved. There might be an investigation. It could lead to early dismissal from the program. It could lead to you needing to come home, could lead to a lot of things. The last thing that I'll mention here is the legal repercussions. So this is obviously very rare, but occasionally there are legal repercussions to how you behave in a different country. I think Sean is going to mention a little bit more about this in his health and safety part. But the big thing to remember is that if you are arrested or go to jail, there's not a lot we can do to help you. The most we can do to help you basically is to put you into contact with an embassy, and they then can help you maybe get a lawyer, but we have no jurisdiction in foreign countries. So as much as you can before you go abroad, learn about the local customs and laws and things like that. And don't get in trouble. Okay, the last thing we're going to talk about is passports. This is pretty easy stuff, but just in case. So we've got passports, do's and don'ts, and Katie, who made the slides, gave us a very nice thumbs up, thumbs down, just so we can remember. So one, make sure your passport is signed and all of the information is correct before uploading it into the Vols Abroad portal. We've had students who haven't signed it. It's not valid. If you don't sign it, please sign it. We've had students who a week before their trip have realized their name is spelled incorrectly. Please make sure everything is correct on your passport before you upload it. Also, another thing, and we're going to say this a lot, make sure that if you have applied for a visa, the information on your passport and your visa match 100%. If it doesn't, you probably will have issues at the border trying to get in or out of the country. So please make sure that those things match. Another thing that you should do is lock your passport in your luggage or another secure spot when not in use. So again, if you're on a faculty directed program, you don't know where to put it, ask your faculty. Most of the places that you will be staying usually have some kind of a safe or something. Sometimes at a hotel, the front desk will keep it for you, whatever. But I would actually like keep it in a safe place, in the safe, in your room, if you can. That would be awesome. Also, check your passport validity requirements. Most places that you're traveling abroad require you to have a valid passport 6 months past the date, past the end date of your program, basically. So just make sure that your expiration date is not before that. That would be great. And then the last thing, again, your name on your passport, your name on your visa, they should match. Please make sure that we do or that they do. We don't want any emergency phone calls. And honestly, there's not a lot we can do at that point. We can say, we're so sorry, but make sure that they match. Please don't make any other marks in your passport beside your signature that are not made by a government official. So on those pages where your stamps go, don't put anything else in there. And then only mark your signature in blue or black ink. Don't carry the passport around town with you. You should carry a copy of it. So either a picture of it in your phone or a physical copy. You should have something on you that identifies you in case you get stopped or whatever, but not your actual passport, because if it gets stolen, it's a huge pain in the butt. And then the other thing, though, about this is also don't leave your passport behind if you go traveling. So if you're going to stay in, say, a different hotel or you're traveling to a different city or a different country, remember to take your passport with you. You will need it. If you need information or anything about passport, there's the passport services information at the bottom of the screen there. Okay, I'm going to let Sean Lenker take it over from here, and he's going to talk to you a little bit about health, safety, and insurance information.
Great. Thank you, Kate. Yes. So as Kate mentioned, my name is Sean Lanker. I'm Assistant Director for Global Security, Risk, and Resilience in the Global Center for Global Engagement. So I'm here today to talk to you about some of those things. So we're going to talk about some resources that you have available while you're abroad, including our assistance provider, Crisis 24, and insurance, which is Chubb. We'll talk about common incidents that we've seen abroad, just so that you're aware and can prepare accordingly. We'll talk about some global security risks and emergency action plan, including resources that you have available to you while you're abroad. We're going to talk again about alcohol and drug use. It's going to be a common theme that you'll hear us talk about because it is a big issue and leads to some of the incidents that we see while abroad. And I'll talk a little bit about physical and mental health and what you can be doing now before you travel to start preparing for those types of things. So I'm going to kick this off with Crisis 24. So Crisis 24, as I mentioned, is UT's 24/7 medical security and emergency assistance provider. It's a really great company, and it can be a really helpful resource, both if you need assistance while abroad, that is kind of their bread and butter. So you can always reach out to them at the hotline number provided there. Um, they're just a great resource. So if you needed help, say you had concerns because there was a protest that popped up in your host city and you weren't sure how to navigate around it, you can call them and they can help you navigate that situation. Say you needed to find a local clinic or hospital. Say you were traveling on the weekend, to Kate's point, and away from the program leader, so you weren't sure who to ask. You can call Crisis 24 and say, I need help finding a health clinic, and they will be able to find you not only a health clinic, but one that's reputable and will make sure that you're getting good care and will monitor the situation. And an added benefit of Crisis 24 is that they also have medical team on staff, including nurses and doctors. So if you were in the hospital, for example, they could review your medical information if you give them permission to do so and make sure you are receiving appropriate care while you're abroad. Um, it can also be used as a pre-trip resource. And so this is where we have a link. Maybe we actually have a resource folder full of links. I'll be talking about various links. I know you guys cannot click on the screen. And so we'll drop that in the chat so that you can click along as we go along and it will have some of this information. So one thing I would recommend you do before you travel, you can do this now, is you can start creating your Crisis 24 UT login or profile. So basically you go to this link, make sure you're using your at tennessee.edu email address, not at UTK. It has to be at tennessee.edu. And then you can create a profile, and that's where you can start looking on the side and see risk information related to your specific country or even city for bigger cities, and start getting a sense of, okay, what do I need to be aware of? What should I be doing to help keep myself safe, for example? One of the benefits of utilizing Crisis 24 if needed while abroad is that they can usually work with the medical provider to do direct payment for medical care. That's a great benefit because then you don't have to pay for things out of pocket. That's not always possible. It really depends on the medical provider. I think most of the time the medical providers just want to be paid, and so they're happy to take that direct payment. But there might be circumstances where you might have to pay out of pocket and then save your receipts and go through the reimbursement process. So let me show you that next part because Crisis 24 is not that health insurance. This will be your health insurance if I can get to the next page. Oh, sorry, before I get to the health insurance, here's also the apps. So if you want to create again, create your profile, I would recommend that you download the app before you travel. You can see here, you can download it on the Apple App Store or the Google App Store, which I know are the two main mobile carriers these days. It's really great to do it that way. It's just so you have it. Especially if you turn on your location services, and no, don't worry, it does not drown your battery or anything like that, or drain your battery. The benefit of having it on your phone is one that you can easily pull it up and say, I need assistance. And then you can just hit a button and it will connect you to that call center immediately. And it will also, if you would enable location services, it will be able to tell where you're at. And so it gets very granular. So it could say, hey, again, let's say there's a protest where there was an apartment fire right here on this street. You're only a block away. You should be aware of this, right? So it can be really great. I do recommend one, download the app, and two, do share your location services. We're not going to be like monitoring you. We cannot monitor you or like see like what you're doing. So don't worry about that. Okay, so there's two different resources that work in tandem with each other. So one is our assistance services, which is Crisis 24, and then on the back end is Chubb. This is our international health insurance. Like I said, if you work with Crisis 24 from the get-go, from when you need assistance, not only can they help you find a place to go, but they can also usually work with that provider to do that back end billing so that you don't have to worry about paying for it out of pocket. Um, Coverage, we will be sending this before your program. So probably, I know your number of you are going in the next few weeks. Just be on the lookout for your email. We'll be sending you information both about Crisis 24 and Chubb, including Chubb's benefit brochure, which I do recommend you read through it carefully. That'll help you better understand what's covered, what's not covered. It's a really great coverage. I always joke that I wish that we had it available here domestically just because it covers a lot of things 100%, right? Um, that does, if you're not utilizing Crisis 24 or having to pay out of pocket, that does mean you still have to pay for those things, but then they should be covering you if you submit for reimbursement. And so we can help you navigate those situations if you ever do need to submit a claim for reimbursement. If we needed to utilize or say something happens abroad, knock on wood, related to a medical or security emergency that required an evacuation, we'd also be working with Crisis 24 and Chubb to make sure that happens. So rest assured that that's all kind of covered. You're not going to be stuck with some bill because you needed to get evacuated for a covered medical issue. Please note that Crisis 24 and Chubb are not travel insurance. So what do we mean by health insurance versus travel insurance? So health insurance is medical insurance. This is what is going to be covering you if you get sick or injured abroad, and it'll help cover those bills. It's not going to cover things like delayed flights or missed flights or lost luggage or stolen items. That's travel insurance, and that is not covered under our insurance. If that's something that you're interested in, that is something that you'll need to explore and find on your own. Yeah, I've had, students in the past have covered things like their phone or their laptop, expensive items, maybe a digital camera, things like that. And so that's not going to be covered by Chubb, especially electronic devices. Every year I talk about this, and every year we do have students asking, "Hey, can I actually, my phone was stolen. Can I get that covered by insurance?" The answer is going to be no. So if you are interested in something like that, please look into it now and purchase something that fits your particular needs. Um, a few other notes here. Like I said, please do review that policy brochure before when you receive it in the coming days or weeks, just so that you are aware of what it's covering, what it's not covering. Things that are not covered are things like routine dental care and physicals. That's not really its purpose. It's supposed to be for, you know, um, injuries or illnesses and things like that. So if you had an injury that it impacted your teeth, that would be covered. If it's something you just need, hey, I need to get my routine cleaning, that's not going to be covered. Also, when you do get your brochure and review it, I will both in the resource that we already shared with you, but also at the end, there's my email address. You can always reach out with any questions or concerns you have related to Chubb or Crisis 24. This website here, I would recommend you scan that, maybe save it, bookmark it. It's going to take you to the CGE's page that has all this information. So if you want a sneak peek at the brochure, it's going to be on that page. This will also have Crisis 24 information. I know there's a lot of information we're throwing at you today, so that's why you want to bookmark some of these. This is also the web page if you did pay for something out of pocket and needed to go through reimbursement. It has the reimbursement form, for example, in the process, who you need to email, things of that nature. So it's a really helpful page, and I'd recommend you bookmark it now. I'm going to pivot a little bit. So, what are the kind of common incidents that we see abroad? We went over resources that are available to help prevent incidents. That's Crisis 24. You can start reading about risk information, what's going on in my country, that my host country, that I should be aware about. But things do happen, life happens, and so what are some of the types of incidents that we do see every year, and what that we respond to? We do see a lot of that lost and stolen items, which is why I was kind of harping on the how our insurance isn't going to cover some of these things. Um, Similar to like what you might see in Knoxville, it's a lot of like more petty crime, opportunistic crime where an individual might steal a, laptop or a phone, whether that's on, I think public transportation is always an area you want to be careful about, keep your bag in front of you, for example. Or, I've had students in the past like maybe going out to study at a cafe and they run to the bathroom and they leave their laptop on the table. That is not a good idea. Do not do that, right? Take your things with you. Do not, as much as I want to live in a world of we can trust all each other, we do not quite live in that world yet. So please do make sure you're taking those precautions. We do see, as I mentioned earlier, probably 80 to 90% of our incidents, if we trace back, was alcohol involved before the incident took place. The answer is usually yes. And so that's why we talk a lot about it. And I have a whole slide on alcohol, so I'm not going to go into it in detail, but we do see a lot of incidents stemming from alcohol or related to alcohol. And then things like interpersonal conflicts, you might be living with people you've never met before, and similar to like when you moved to UT, right? If you had a randomly assigned roommate, it can be work, right? Trying to meet somebody new and see how they work and how you work and how you guys get along. And so just know, if you are ever having an issue in that area, that's something that you can reach out to your program leader about or your program affiliate about. Our goal for any incident is always to try to tackle it while it's still at a low level and not let it grow into a full-blown, crisis or emergency, right? So raise issues often and early is my advice. Um, if you do have, if you are one of the few that get an item lost or stolen every year, the ones that we see every year, do let your program leader know. In some instances, especially for like if you did get insurance, they would usually require a police report. So you would want to make sure you're filing that. The program provider that's supporting the program or the program leader should be able to help you navigate that situation and make sure you're getting to the right place in order to file a report. Um, and this is that reminder that our insurance does not cover those things, cell phones, cameras, computers, etc. If you do lose your passport, this does happen to students every year as well. That's where you're going to have to go to, if you're a U.S. citizen, to a U.S. embassy or consulate in the host country for an emergency passport or replacement passport. And so again, that's where you can work with the program leader or the program provider, and they can help you figure that out. You're not always going to be in that location where the consulate or embassy is at, and so that's where there might be some more logistics involved. Just know that you're not alone, and that we can support you through that process. And then please make sure you're saving, the address, phone number of consulate in your phone, or an online platform. I do recommend, and I'm going to go through emergency resources, and that's always best practice is just save it in your phone now, so you're not scrambling to find this number and when you actually need it. And I'd also recommend saving a number of these things, including like when we send you the insurance brochure, we'll have a one pager related to Crisis 24. Save it to an online platform like Google Drive or something of that nature, SharePoint, so that you can access it easily while you're abroad as well, and you're not digging through email. So those are common incidents we see abroad, but what else do we see in the world these days? I think it's again similar to what we see in the United States, right? Natural disasters. There's a persistent threat of terrorism across the entire world. Street crime, that's a major one. We do see protests or political unrest in some locations. Usually, it's more of the form of protest, but it can grow in some locations to political unrest. So recommendations there is that especially this is something you can be doing now before you travel, is start looking into and doing some research about like, okay, what are some trusted local news and media outlets that I can follow while I'm abroad? That's a great question too. So, each one of you, and you'll hear me talk about this in-country orientation, you're doing a pre-departure orientation right now. But each one of you, when you go abroad, you're going to have an in-country orientation that's going to be a lot more specific to your program. We have a lot of programs here. We have a lot of individuals going to a lot of different locations. We have to keep it rather general. But that's an opportunity to dig into really specific questions or concerns you have related to your program. And so if you're not sure, like what's a trusted local news source I can follow while I'm here, ask that question at your in-country orientation, and they can help link you to it. And then that's something to start following just to see, okay, what's going on in my host city? What's going on in my host country? Because the US media does not usually cover that many, maybe big events abroad, but not the detailed, day-to-day goings-ons. So I'd recommend you follow that. Make sure you can, when you create your profile with Crisis 24, you can sign up for alerts. Again, that's a benefit of having your phone or getting the app on your phone is that it will push out alerts to you real time. I often get alerts from Crisis 24 before I see any, I can use the example of the tsunami last week, tsunami warnings related to the earthquake, right? They are using things like AI and data mining so that they're really on top of what's going on in the world. And you'll get an alert before you ever get something from like the New York Times, right? So it's a great resource. Please do download the app. You can also sign up for the U.S. State Department Alerts and Guidance. That's where you can enroll in this Smart Travelers Enrollment Program or STEP. You will have to sign up on your own for that. It used to be possible for us to sign people up for STEP, but they've changed their processes and now individuals have to do it themselves. I do recommend that you do that. That will give the local U.S. embassy and consulate in your host country that information that you're abroad. If they push out a travel alert for individuals in that country, it will make sure it's going to you. So I believe you can sign up for both email and I think you can also sign up for text alerts from them as well. It might depend on the country. Um, but it's something that you should definitely sign up for. It's also included in that resource card in that link that we shared with you. So please take a look at that there. Um, and really, again, because this is a general session and I can't dive into specific programs and locations, I also can't dive into specific, issues related to yourself as an individual human being. But you know yourself probably better than anyone knows you, right? And so this is something, again, that you can be doing right now before you travel, and then you should do this before you travel, is thinking about who am I and what am I bringing with me while abroad? So like what are some issues that um, different parts of your identity that could or may cause an issue. Maybe it's not going to be an issue. Maybe issue is the wrong word, but something that you're bringing to the table that you will have to navigate while you're abroad, right? And so those can be related to your gender, your sexual orientation, your ethnic identity, your nationality. What are you bringing with you to your specific location, and how are you going to navigate that? Start coming up with a plan now. Other areas to research include things like appropriate dress in your host country. What are some communication styles in your host country that you should be aware of? There's always the kind of stereotypical certain hand gestures that mean one thing in one country and a very different thing in another country, right? And so being aware of those types of things. What are even conceptions of personal space? We have our own conceptions of that in the United States can be very different from different locations abroad. So that's a lot of areas, and that's again where you can use your in-country orientation session to ask really specific questions because that's these people are, have a lot of experience in these locations or maybe natives of these locations. And so you can ask really specific questions about like communication, dress, things of that nature to your program leader and the program provider. So please do ask those questions. And then please make sure you're keeping your cell phone charged while you're abroad. If there is an incident when we reach out, usually we're going to start with just because we might have a number of people impacted, we'll probably be reaching out via email to do a check-in, or your program leader will be doing an email check-in. So please do monitor your phone, computer for emails. If we're not hearing back from you, that's when we might escalate to phone calls. I've even had to track students down on social media to make sure they're doing okay. So just make sure you know that we're probably going to be reaching out and that you should be, please do answer us if we're asking if you're all right, just so that we can know. It's always a good idea too to think about like, okay, how am I keeping my cell phone charged? Something like a power bank, although you should look into your power banks because some are not probably great on flights and things of that nature where pressures are changing. So do a little research on that. Um, but it's a good way to help keep your phone charged or purchase one while you're abroad. Just general best practices to follow. And again, I would say the same thing in Knoxville, right? And so you've now been, I know you're different levels of your undergraduate career or graduate career at Knoxville, in Knoxville, but you've had to navigate maybe a new city for you. And so it's similar to what you'll be doing when you're abroad. And that is really, especially when you're out in public, staying aware of your surroundings, trying to maintain a low profile and trying to fit in, not standing out, or attracting attention to yourself in a negative way where somebody might be like, oh, there's a rich foreigner, I'm going to go rob them, right? You do not want to be that target. Follow that local guidance. Again, each of your in-country orientation sessions should have a nice section on very specific country or city-specific health and safety guidance, and that's where they'll say, "Hey, don't do this, don't do this." Um, Especially from this is a great issue area if it's not brought up in your in-country orientation, but you should ask about it, saying like, are there parts of the city that I should avoid? Are there parts of the city that I should avoid at night, right? Any city has areas that might be okay during the day, but changes at night. And so just being aware of that. You're not going to know that unless you've been to the city and are intimately familiar with it. But these people that are running the program should know this stuff and should be able to provide guidance or can ask some questions and figure that out for you. So please do ask that. Always refrain from wearing flashy clothes and jewelry. Consider how your attire may be perceived by the local community. Same with, I think I've had this happen with multiple students, right? Where they might go out for like a morning jog. Some locations around the world are like, what are you doing? It's just jogging is not like a part of their culture, right? And so not only are you jogging, but you might be wearing some very form-fitting clothing, and running with a barely, $1,500 iPhone and with $300 earbuds in your ears. Well, that is bringing a lot of attention to yourself. And especially with the phone, you want to keep that phone in your pocket. That's really one of the main distractions we see these days. Is not paying attention to what's going on around you. And so try to keep that phone in your pocket. I feel, especially these days, people, when they feel uncomfortable, go on their phone. Well, sometimes you need to pay attention to what is happening around you. So put the phone away. Watch your valuables, like I said, especially on things like public transportation. That can be a common area for pickpocketing or for like bag snatching and things like that. There used to be a popular TikTok video from this woman in Italy that would say pickpockets. So things like that. So make sure, again, don't like keep it on the shelf above you or under you. Put it on your lap, right? Just keep things with you. And then I think it's underrated, but you should definitely listen to your gut. We've evolved in certain ways, and our guts are not always right, but they can send us a signal that, hey, again, this might be like, put your phone down and look around you because something doesn't, it feels a little off, right? So just listen to your gut. I do want to plug a page, and this is also included in the links that you can access in the chat, which will take you to this page. So we set up a page that's called the Travel and World Events Updates or World Travel FAQ. That is where we're monitoring kind of really big impacts around the world. There you'll see some guidance around like Russia and Israel and Gaza and things like that on there. But I also want to plug it because, especially if you're an international student, I know that we get a lot of inquiries about, okay, what does it mean to go abroad right now as an international student? And what does it mean to return to the United States as an international student? And so know that we do have some resources available to you. If you go to that World Travel and Events Updates page or World Travel FAQ, that will include links to International Student and Scholar Services. That's another unit within the Center for Global Engagement here at UTK they have a whole immigration updates page that you should be aware of and follow. Bookmark that page just because they are constantly monitoring what's happening in the United States and can help give you some guidance. And then you'll want to make sure that you are following. There's certain things, if you're a visa holder in the United States, you need to do before you travel abroad. A lot depends on your visa status and which type of visa you have. They are the experts. So go to that page, reach out to one of their advisors if you have any questions, and they can help you navigate that process. If you do have specific questions related to your own status or to, you're an international student, you're not sure what to do, you can always reach out to me. There's my email at the bottom here. So please do reach out and I will help you connect to the right people or answer any questions you have. I know we've given you a lot of information already in this health and safety realm. We're going to wrap it up here. We'll just talk a little bit more about just your physical and mental health and the importance of taking care of those. Again, this is like the idea that I was mentioning earlier about kind of prevention or addressing issues when they are still minor so that they don't grow into major issues or emergencies. So that applies like very much so to your physical and mental health. If you find yourself physically having some symptoms related to like stomach upset or something like that, take some, some medication so that you're not dealing with a bigger full-blown crisis later. Same with mental health. You know yourself best. And this goes back to when I'm talking about cultural issues or gender issues or things like that that you're bringing with you abroad. Start thinking about it now about what are some mental health challenges or what are some physical health challenges that you deal with in Knoxville that you will be taking with you while abroad. I think I have seen in the past some students have sort of magical thinking where they think, I'm dealing with this mental health challenge abroad, but abroad's going to change me and I won't have to deal with that. You are going to bring this with you, right? Or you might have new situations or issues that come up while you're abroad. And so, do think about it now while you have the time and luxury of thinking about these things to start developing a plan, saying, I know I deal with high anxiety, so how am I going to deal that while I'm in a new location, right? And especially if you're using going back to mental health, you might use as part of your coping mechanisms, your support network. And you might not have the same support network while you're abroad. You might have them in a different capacity, whether you can access them with Zoom, Teams, phone, text, whatever. But if you're used to being able to rely on somebody in person and they're not there, there you go. How am I going to deal with that? Right. So think about what you are bringing to the table. Think about what you are dealing with physically and mentally, and start thinking about, okay, that is how I'm going to handle that situation while I'm abroad, because more than likely it is going to come up. If you do have a pre-existing medical condition, we do recommend you talk to your doctor before you travel about how you are going to get adequate care while you're abroad. That might include things like medication, or if you have a specialized, if you need to see specialists. Again, we can work with you. We can work with Crisis 24 to set up treatment plans or make medical arrangements, but we need to know about them. So please do reach out if we can be of assistance in that area. If you have a therapist or counselor, I would recommend that you talk to them before you travel abroad, because part of what they can do is help you come up with that plan, saying, okay, I'm going abroad. That's going to be a big change for me. So how am I going to deal with that X, Y, or Z while I'm abroad? A lot of therapists and counselors, post-COVID, have been willing to work with their clients while they're abroad. That wasn't always the case before COVID. So that's something you could discuss with them as well. If that's something they cannot provide, but you do want to, you're used to talking to a therapist or counselor, know that we can help set you up with that while you're abroad as well. Please make sure you probably remember from your Vols Abroad portal application, you had a very long physical and mental health disclosure form. Please make sure you are disclosing anything to us. We can't really help you if we don't know about a situation. So please take that seriously as well and reach out if we can be of assistance in that area. And then just in general, just know that we are always a resource. It says the provost and vice provost in that video. We are here to support you. We are here to help you navigate these types of situations. So if you do find yourself struggling with mental health, things like culture shock, things like homesickness, these things can happen, right? And so you are not alone. You do not have to struggle alone. We can connect you with resources and make sure you're getting the assistance that you need. Here are some strategies, to help support yourself. Again, this is, what works best for your own self. So, even Brad was just talking about some things, including like, personal boundaries. Those can be really helpful in these situations. Please know that as part of our relationship with Crisis 24 is that all of you are eligible for 6 free telehealth mental health counseling sessions that you can take advantage of. And so please do know that that is an option. And like I said, they're free. If you needed more assistance, it's not like 6 and you're done. We would work with Crisis 24 and Chubb to make sure we're either finding a new telehealth option for you or an option in country so that you can continue on that kind of journey. Things like deep breathing exercises, limiting time on spent social media. I think that's so important. I already talked about put down the phone. So much of this is caused by phones these days, especially social media. Every year I think students in particular are comparing their experiences abroad to other students on experiences abroad, whether that's on the same program or other locations. But please know that people are only posting the highlights of their life on social media. They are not posting the day-to-day struggles or what they're going through. And so please do not take it seriously and do not compare yourselves to other on there. Again, I think that's put the phone down, go touch some grass, get outside, go for a walk, know what works for you if you find yourself in a situation where you're just feeling, overwhelmed. But again, if you're feeling overwhelmed, reach out. We can connect you with resources. So I'm not going to go through all those points, but just know that you should think about what works best for you in these situations, what works best for you here in the United States, what's going to work for best for you there, and reach out if we can be helpful. I will touch briefly too on medications and immunizations. So I know a number of you will probably be bringing medications abroad to deal with whether it's mental or physical health issues, which is totally great. Just I want to encourage you to consider the legality of your medications. That is something that Crisis 24 can work with you on. So if you are not sure about the legality of medications, you can reach out to me or you can reach out to Crisis 24 and we can help you figure out the answer to that question. There's a common one I always use about Japan, where in Japan something like Adderall is not legal. So okay, if you were going to Japan and you are have a prescription for Adderall, what are you going to do? All right, we can talk through what might be some alternatives or what the plan might be in that situation. So please don't just assume that you can bring any medication anywhere just because it's legal in the United States. If you're not sure, reach out to Crisis 24 or myself. We can help you look at those restrictions, cultural perceptions, things of that nature. If you are bringing medication, please best practice would be bringing actual like a doctor's note. Just this is more for like customs or border patrol. If they look at you and ask you, hey, what is this for? They're basically checking to make sure you're not bringing illegal substances into the country. If you can provide a documentation, like a letter on doctor's letterhead saying this is the purpose, yes, they need it, they have a medical condition, that's always great. So I would recommend you get that if possible and make sure you're bringing that with you on your carry-on, not putting it into your checked luggage where you're not going to be able to access it at border control, right? That's going to be not available. Make sure you're bringing that adequate supply if and when legal, and make sure you are packing your medication also on your carry-on and not in your checked luggage. We've had situations where students have put it in their checked luggage gets lost, then they are navigating, hey, I don't know how to get medication. We can help you find medication in your host country if it's available there, but you don't want to put yourself in that situation in the first place. Um, I would recommend you also make a copy of your prescription and save online for easy access if needed. Again, this is where you're going to use something like Google Drive or SharePoint, somewhere you can just access that if you do, need to utilize it while abroad. And then if when you're packing your prescription, make sure you're putting it in the original bottles and packaging only. It's usually those orange bottles, right? Keep it in that. Do not take it out and put it into something else because that has your prescription information, that has your name on it associated with you, right? So that's what they would be looking at. And then for vaccinations, again, because this is such a general group, this is where I'd recommend you look at the U.S. Department of State's website. They will help you understand if you need or if there's any recommended or required vaccinations for your particular destination. If you do have required, you'll want to make sure you have a copy of your vaccination records for sure. And then finally, I'm going to round it out here with just talk a little bit about emergencies. Again, I know this is a lot of information. We will be sending you this information via email along with Crisis 24 and Chubb information. But briefly, what do we mean by emergency versus a non-emergency? So an emergency is like basically any life-threatening situation or illness, violent crime or assault, if you're a victim of those things, a local world event that could threaten your safety, again, like natural disasters or terrorism, things of that nature, versus a non-emergency like lost or stolen items, delayed or missed flights, or other transportation disruption, common cold. So, not that the non-emergencies aren't important. Those are things that you should let your program leader, or the program provider for your program know about, so they can help navigate that situation. But you might not need to call our emergency phone at 3 o'clock in the morning related to, a cold or allergies or something like that, right? If you do find yourself in an emergency abroad, we kind of designed this flow chart to help you figure out, okay, what's the best course of action. So I'd always recommend if you need something like the police or fire department or an ambulance, you need that immediate assistance, call the 911 equivalent in your host country, just like you would call here in the United States. That is available in the resource list that Katie shared earlier. So click to that. There's a great resource from the State Department that has those 911 equivalents in your host country. It's not always 911, right? So know that and I would save that to your phone as well. Communicate with your program leader, in-country program contact. Most of your programs are working through providers or host institutions that have their own health and safety teams. That will be something that they cover in your in-country orientation. That is where you want to pay particular attention because they'll say, hey, after hours or 24/7, if you need assistance on the ground, call this number. Save that number in your phone. That is who you want to reach out to. You can also always call Crisis 24. You can always call the Programs Abroad R 24/7 emergency hotline, but we're going to try to utilize some of those on the ground resources, right? And so you can go straight to that if they have some resources available, which they should. So please do pay attention during your in-country orientation session. But you do have these other resources if needed. Crisis 24 and our emergency phone number are both 24/7 as well. Like I said, save these numbers. Take a screenshot of this right now. It's also available on the website and in the resource list that we sent you, so you don't have to worry about memorizing them at the moment. But do not just write them down. Take the time, take the 10 seconds to save it into your phone so that you can pull it up if needed. You can pull up PAO emergency phone. You can pull up Crisis 24. If you get the Crisis 24 app, it also has a button, one hit button saying I need assistance, and it will call them, right? So please utilize that. And then take some time before you travel enrolling in the State Department STEP program. As I said earlier, it will just make sure that they understand that you're abroad and they will send out any issues or alerts that are reaching out about. So that can be a really great resource. Uh, One final thing that you can do before you travel abroad is just think about, especially, you can't assume that everybody's going to be speaking English abroad in your host country if English is not the main language. And so think about just some common phrases. There's a helpful sheet here, or you can take a screenshot, or just you could probably find some good websites that do something similar. But start thinking about like how would you say some of these key phrases in that host language. So again, you're not scrambling, help me, I need help. I am lost. No, yes, thank you. U.S. Embassy. So please do think about that and start trying to fill that out so that you can have that available in your brain when you're abroad. Finally, one last bit of information is that all of this is also included in the Study Abroad 101 guide. That is also available in the resource list that Katie sent out earlier in the chat. You can also scan that with the QR code, and that will take you there. That has, even more detail. I know I went through a lot of detail, but it has more information about health and safety and emergencies abroad, your emergency resources, and also other issue areas that we've been talking about, academics abroad, finances abroad, things of that nature. So it's a great resource. Please do utilize it. And I believe with that, I am going to be turning it over to my colleague, Jess.